Opioid use disorder has posed a particular challenge. The intellectual process of providing healthcare is to start with a problem, introduce an intervention, and expect, plan for, and have a goal of a positive outcome. Opioid use disorder has historically not allowed us to do that because we didn't have the intervention piece that made sense to us as clinicians, that made sense to us as medical providers and nursing providers. So deploying MOUD, methadone, Suboxone is a wonderful way to finally get traction with this clinical problem. I think what I find with my outpatient practice and my inpatient practice in substance use disorder and opioid use specifically, patients are vulnerable and forthcoming. Who of us doesn't want to tell our story? I think we have developed a culture of not asking. And so if we don't ask, we don't have to address it. But to sit and talk about your experience, especially experiences that are so consuming, which opioid use is, and so compelling in the lives of our patients, to open up the door for real collaboration and for storytelling and for truth-telling of that experience is incredibly gratifying because patients meet you there with the opportunity to provide Suboxone and prescribe Suboxone without an X waiver. Really, it's my opinion that it's incumbent on all of us to become familiar and comfortable with this pharmacologic agent, just like we would a new insulin or a new blood pressure agent or a new anticoagulation drug. It gives us a tool in our toolbox that is meaningful, that is evidence-based, that is actually demonstrates over and over again that there are positive clinical outcomes. It is really lovely to run into a former patient in the grocery store aisle who once was living outside in a tent and out of touch with their own humanity and suffering in ways that we can't imagine from our place of comfort and privilege. And to see them get to know themselves again and restore relationships with themselves and their families and their community and become part of it again in a functional way and just live with the ordinary challenges of life is really gratifying, and I get the opportunity to do that, and it pushes me forward for sure.